Can you? Okay. So first, just to answer the question about the urine. So there are lots of labs that can test for 2,4-D and atrazine that have the right kind of equipment to test for that, but there's another level of certification that's required to be able to handle human biological samples. So, for instance, RDEQ has the right kind of laboratory equipment to test for 2,4-D and atrazine, but they don't have certification to receive human biological samples. So it's hard to find labs that have both of those things, the right kind of certification, and also the right type of equipment. Okay, so we're going to talk about the Oregon Health Authority's role, Public Health Division's role in pesticide exposures, and well, not in exposing people to pesticides, but in yeah, like this. Okay. I'm going to start out talking just a little bit about very generally about human health and toxicology of pesticides. There's not enough time to go into specifics of particular pesticides. So we like to start always by first explaining what is a pesticide. Pesticide is an umbrella term that describes all these things: herbicides, insecticides. So it's a pretty broad term. In forestry, herbicides are the main type of pesticide that are used. But as the previous speaker said, the actual solution that is applied is always a mixture. And you can break that mixture down in different ways. One way is the active ingredients versus the everything else. And I'm kind of broadly calling the everything else additives. And those are kind of further broken down into adjuvants, or sometimes they're called ingredients, although often they're as toxic as the active ingredients. So I just listed a couple of the herbicides that are commonly used in the Coast Range forests. So the toxicity of mixtures is pretty complicated. The chemicals in the mixture can affect one another's toxicity. And that the interaction can be, there's different types of interactions. The first one that I listed here is additive, meaning that the toxicity of the overall mixture is what you would predict by adding up the individual toxicities of the chemicals in the mixture. The second one listed there is antagonistic relationship, where the overall toxicity is less than what you'd predict by adding up the individual toxicities. And the synergistic one is, as has been mentioned, is one type where the overall toxicity is greater than you would predict by adding up individual toxicities. And the last one there is probably the rarest, called potentiation, where two non-toxic chemicals can actually potentiate each other or be toxic together in a mixture. So there have been, there's not a lot of studies, toxicity studies using mixtures. It's pretty complicated to do those types of studies. But there have been some with active ingredients, different mixtures of active ingredients. And there are some types of insecticides in particular where additivity and synergistic interactions have been demonstrated. For herbicide active ingredients, so far, only additive and antagonistic interactions have been demonstrated. But it's important to note that those studies are, not every combination of active ingredients has been tested, and there's also the additives. There have been few studies where they've tested mixtures of additives and active ingredients. So the symptoms of pesticide exposure are non-specific. So I'm going to just explain the difference between a specific and a non-specific symptom. This is important for you to know if you are exposed to a pesticide. So a specific symptom is one where the symptom can only be caused by one thing. So mesothelioma is a type of lung cancer, and the only way you can get that is if you've been exposed to asbestos. So if your doctor diagnoses you, that's the first thing they'll ask is, when were you exposed to asbestos? Same thing with, here's a picture. If you see a child whose arm looks like this and they have a fever, you can diagnose varicella virus as the thing that caused that illness. Those are specific symptoms. But the types of symptoms associated with pesticides are things like headache and vomiting, nausea, which can be caused by pesticide exposure, but can also be caused by many other things. And the reason that's important for you to know is that if you've been exposed to a pesticide and you go to your doctor, it's important for you to tell your doctor about the exposure, because there's no combination of symptoms that would cause the doctor to diagnose pesticide exposure. They wouldn't know about it unless you tell them. So it's important for you to know. Now, so there's many different types of symptoms and health effects that can occur after pesticide exposure, and which ones you get and whether or not you get them depends on the dose that you get. So dose is important. And there's a relationship between the dose and the response, or how much you get and how severe the response is. And the easiest type of relationship to understand is this kind, where it's a pretty linear dose response, where every increase in dose correlates with an increase in the response, or the illness. But there's a lot of chemicals, and many chemicals follow this pattern, but there are also a lot that have different shapes of dose-response curves, where at a higher dose you have less effect than you have at a lower dose, and it's not always predictable. And those kinds of relationships are harder to understand. The type of exposure influences what health effects you get also, whether it was an acute exposure or a chronic one. So just so you know, that's not pesticide being sprayed on that little girl. That's an ordinary garden hose. So exposures can be acute or chronic. That means an exposure can be short-term or it can be long-lasting over time. And effects can also be acute or chronic. So an acute health effect would be one that happens soon after exposure and is really noticeable and you know that it's happened. The chronic effect might not set in for many years after the exposure has happened. And there can be some mixing and matching between those things. And acute exposure can lead to a chronic health effect. And like I said, there's not time to talk about all the different symptoms and health effects that are associated with pesticides, but for acute exposures, the most common ones are things like headache, nausea, vomiting, diarrhea, and skin rashes, irritation of the eyes and nose and throat. And those are pretty similar across all types of pesticides and all types of additives. So the acute effects often look really similar across many types. So knowing as soon as you can what the exposure was can help the physician know what to do. So the rest is for Curtis.
Thanks, Dave. Let's see if we forgot my...
I'm just going to check a mic. Sorry, Curtis. I just want to check and make sure your mic is on. Sorry. Just checking. I apologize.
Right.
Okay. Thank you.
You're welcome. Okay, so before we get into the public health division's role related to pesticide exposures, let's take a step up for just a moment, and we'll talk about the state of Oregon as a whole. So you should know that the state has a response plan for pesticide incidents that uses multiple state agencies and their expertise. So each agency has specific standard operating procedures put together as one document to establish a statewide framework. The Pesticide Analytical and Response Center, or PARC, coordinates the agency's response and communications between them. So this pie chart shows the agencies involved in PARC. The blue wedges have enforcement authority, while the yellow are supportive. Now, each agency plays an important part in the regulation, incident response, and protection of our citizens, wildlife, and environment. One important point to remember is there's no wrong door to report an incident. If you're working with or have a contact in any of these agencies, you can report the incident to them, and the information will be forwarded to PARC and then to the appropriate agencies to respond. And I'd just like to take a moment to point out that there are a few representatives of some of these agencies in the audience. Of course, Dave and I are from the Health Authority. Oh, you can't see that. There we go. Okay, yeah. It's up on the top. Mike is here from the Department of Agriculture. You'll hear from Josh and Brian a little bit later from DEQ. And Kyle is here from the Department of Forestry.
And also Lynn Smith is here from Forestry.
Oh, Blake, all right. Thanks. Okay, so it's important to let you know, as with any other serious incident, there are things that you should know and do. In the case of a pesticide exposure, you should, first of all, get help if someone is sick or injured. You'll want to call the Oregon Poison Control Center. They're the group in the state that has the most knowledge about what to do in these situations. You can call 911. They'll also get in contact with Oregon Poison Control, as will your healthcare provider. So those are the first three resources available to you if someone is sick or injured. You'd want to leave the area, so you remove yourself from that exposure. Try to wash off the pesticides from your skin or your hair if they were exposed. If you can, write down key information, and that'll be important later on when the investigation, if there's an investigation that starts up, you'll have that information available at your fingertips. And then finally, after all those things, report it. And you can get to PARC through this phone number. You can write that down or go to the PARC website. Okay, so here's what you can expect if you report an incident to PARC. Remember, there's no wrong door. PARC will respond to you and investigate. And please note that several agencies may be working together with investigatory and or supporting roles. Okay, so let's focus on the Public Health Division's role in pesticides. Oregon Health Authority has an agreement with PARC to fund our Pesticide Exposure Safety and Tracking, or PEST program, to follow up on select reports of acute pesticide illness and injury, specifically reports involving a death, an interaction with a healthcare provider, work-related pesticide incident, events involving 2 or more people, or a referral from PARC. And we assist PARC agencies both during the course of the investigations as well as through efforts to understand trends and causes of pesticide-related illness. We also provide data to the Federal Centers for Disease Control and Prevention, or CDC, to aid in a national level scientific and policy-making efforts when resources permit. Now, the laws regarding pesticides specific to public health direct healthcare providers to report cases of pesticide poisoning within 24 hours. And when we receive reports of pesticide exposures, whether they're from healthcare providers or from the individuals themselves, we'll interview the patient to try to determine what exactly they were exposed to, if possible, what were the circumstances related to the exposure, as well as when the symptoms began relative to the exposure and how long they've lasted. So again, that's important to try and take down some notes to help you remember those things. We consider the illness or injury to be acute if there's a skin-related symptom, an eye-related symptom, 2 simultaneous symptoms related to an entire body system like the respiratory or gastrointestinal systems, or if the case was referred to us from PARC. So our method of follow-up allows us to identify links between the symptoms, the nature of the exposures, and the nature of the pesticides. We're also able to contribute both to state and national efforts to understand trends in the causes of pesticide-related illness and inform policy-making efforts. It's important to note that we have limited resources to do this work, and no resources dedicated to identify unknown pesticides, nor conduct field investigations of emerging events. In fact, our partner agencies in PARC are best suited for these roles. So here's a little information regarding what we know about pesticide releases and related illnesses from our acute pesticide illness and injury data. The vast majority, 60 to 70%, occur in or around the home. Most of these are accidental self-exposures or bystander exposures involving residents, neighbors, and applicators. Next, you'll see farm exposures, farm-related exposures, and then you'll note that forestry-related releases and reported illnesses account for about 1% of the total number of releases and reported illnesses. And we know that there are more cases of acute pesticide-related illnesses among adults aged 50 to 59 than in other age groups. Let's shift gears for a moment to large-scale exposures or multi-household events like what was experienced by residents of Cedar Valley in Curry County in 2013. One of the lessons that we learned in the Public Health Division is that while we had established communications channels with our partner PARC agencies to aid the ongoing investigation, our efforts to communicate with the local public health department didn't translate into effective communications with local healthcare providers. So as a result, we developed a standard operating procedure that guides our communication efforts to local public health officials during this type of event. We would work with local public health to inform healthcare providers in the area so they could be alerted that folks may come in with symptoms potentially related to this event. We'd also be able to work with local public health to help inform the community so they would be aware of the situation and know what they can do. Finally, our role in communications extends to public health outreach, both with people reporting pesticide illnesses and with healthcare providers treating their patients. For your information, healthcare providers regularly contact the Oregon Poison Control Center whenever they have a suspected case of poisonings of any kind. Oregon Poison Control Center is well equipped to assist healthcare providers and the public in assisting and understanding treatment options for any poisoning. So with that, I'll thank you very much, and I'll look forward to your questions.
What are the acute effects of 2,4-D, acute and chronic effects, and atrazine as tested by the EPA?
So 2,4-D, both of them have, again, similar acute effects. They can irritate skin and nausea, vomiting. Many of the pesticides have the same type of acute effects. For chronic effects, atrazine does increase risk of cancer. That's probably the biggest concern. It is a known endocrine disruptor, meaning that it can interact with the hormone system and can reset things in a way that isn't good. And 2,4-D, there's some indication it may increase risk of cancer and also can cause some. It is also an endocrine disruptor. So endocrine disruptors are concerned because they can affect reproductive health and development for children too. So.
Just a couple more related to kind of the environmental impacts and health effects. There were a couple of questions related to the impacts on pregnant women specifically and birth defects and what documented link there is, if any.
Yeah, there is some. With many chemicals, there's a set of studies that says that there is, and a set that says that there isn't. And but I think that there's enough data out there to suggest that it's not good for pregnant women or developing babies to be exposed to atrazine or 2,4-D in particular. But yeah,